everybody. My name is Ashu Anand. I'm a senior at the Alabama School of Fine Arts in Birmingham, and my student speaker presentation is on addressing the challenges and innovations in global wound care. Thank you all for joining me. Okay, so to start, a little bit about me. Again, I'm a senior in Birmingham, and this is my first year attending the Global Health Leaders Conference at Johns Hopkins, so I was very excited and I'm very grateful to meet all of the new emerging leaders in STEM. One of my strongest passions over the past couple years has been biomedical research, and I conducted cell regeneration research, which I'll touch on a little bit later on. So I also love studying medicine. I love volunteering and shadowing doctors at my local hospital, and I hope to continue that and pursue a dual MD PhD education and move forward with a career in healthcare. Okay, so let's get started with the very basics. What is wound healing? So cell regeneration is a primary process in wound healing, and it involves the healing of damaged tissue, so the replacement of tissue that's impaired after an injury. So in this diagram to the right, you have a specialized stem cell which can differentiate itself into a specific type of cell. Now, these specific cells can integrate themselves into that injured tissue and replace that injured tissue. Now, stem cell regeneration occurs in 4 major stages. The first of which is hemostasis, which involves the contraction of blood vessels prevent that blood from leaking around that wound site, followed by the inflammatory stage, during which chemical messengers and growth factors are released around that wound site, which triggers that proliferative phase, which is the stem cell differentiation and integration along with collagen formation to form remodeling tissue. Now, all of these steps are necessary for the reconstruction of impaired tissue after an injury. But what is the problem here? Now, that problem comes with chronic wounds. Chronic wounds are characterized by an inability to heal tissue efficiently, and they can be caused by a broad variety of reasons. So a very common one is cardiovascular disease, for example, which leads to poor circulation. In particular, poor circulation, typically with diabetics in America, as you can see in this diagram to the right, you don't get enough blood flow to that wound site, and this leads to low oxygen around that wound site, often resulting in tissue necrosis or the death of tissue. Another big one is immunosuppression, or just slow regeneration in the elderly in particular, who can't provide their body with those cells as quickly as we can, and the improper treatment of that wound site, which is what I'm going to touch on today. But all of these reasons lead to an increased susceptibility to infection, permanent nerve damage, and amputations. So why is poor treatment a problem, particularly in developing nations? Especially when it comes to chronic wounds, that trauma requires immediate and effective care. And in rural areas or areas where that treatment isn't available, the improper treatment can lead to these complications, including those amputations and infections. A big one, for example, is contamination of that wound site, which is the leading cause of infections. Now, there are a couple barriers to effective wound care that I'm going to address today. The first of these is resource limitations. Again, in those developing nations or rural areas, those regions lack access to basic medical supplies or the proper sanitation or hygiene, which goes with the infrastructure component of this. And this complicates wound management and increases the risk of infections. But the biggest one in particular, in my opinion, is proper education and training. So there's often a lack of specialized training in wound care among healthcare individuals and providers, which leads to that suboptimal treatment and management, overall leading to poorer wound care. A little bit of stats here. About 50% of the world's population currently doesn't have access to essential health services. 50%, think about that. In that, about 5.6% of procedures in developing nations lead to infections. In the US alone, 6.5 million Americans are annually diagnosed with a chronic wound. And this leads to a global total of 1 million plus limb amputations worldwide. Now, I'm going to move forward with innovations in wound care. In particular, I'm going to look at a method known as electrotherapy. A little bit of background on this. So our cells are interconnected in an electrosensitive matrix. And the theory behind electrotherapy is that the electrical stimulation can actually serve as a directional cue and allows these cells to move in a certain way, in a more efficient way, which is known as galvanotaxis. Now, this electrical stimulation can interfere with post-injury electrical signaling and enhance that wound healing process. And this is in particular what I did my research on with freshwater brown planaria. So freshwater brown planaria are these amazing flatworms that have an extensive stem cell, also neoblast, count throughout their body. And this allows them to regenerate at an incredible rate. So in this diagram to the left, you see this trisected planaria that can regenerate into 3 new worms. In my own research, I bisected planaria, and each bisected segment, so half the planaria, would regenerate within 2 weeks, which is incredible, in my opinion at least. So with my research, I looked at how electrical stimulation could enhance that tissue regeneration process in my planaria. So in this example to the left, I had my bisected planaria, and I exposed those posterior segments to varying levels of electrical stimulation. And I actually found that electrical stimulation at certain levels could enhance that tissue regeneration process. And in particular, my research looked at applications to chronic wounds, as the focus of my presentation is on, and how we can use electrotherapy to serve as a treatment for chronic wound. So this is a couple pictures of me. These are a couple pictures of me doing my research and presenting this at the Alabama Junior Academy of Science, where I was able to advance nationally to the National Junior Science and Humanities Symposium and internationally to the International Science and Engineering Fair in May of 2024. So again, going back to one of the biggest barriers, in my opinion, the education and training aspect of global health. I believe that education is especially important, not only to provide a background in science in individuals, but also to inspire individuals to continue learning throughout their lives, particularly if you start younger. So I actually started a research mentorship program within my community, my hometown in Tuscaloosa, Alabama, to coach younger middle school students about wound care, about my own research, and promote them and encourage them to pursue their own research projects. So in this, I was educating them about my global health project and encouraging them to continue working in STEM, which, again, education is very important. So in conclusion, how can we move forward with this? Touching back again on education and training. So the training of not only healthcare workers, but also the general public in wound care practices and proper sanitation and healthcare can improve the knowledge of infection control and advanced wound care techniques. And so by addressing these challenges and implementing strategic improvements, the global burden of wound-related health issues can be significantly reduced, which is the goal of this presentation. All right, so my references and acknowledgements. I'd like to thank the Global Health Leaders Conference and Johns Hopkins University, my family, and all the teachers who helped me with my research. Thank you all for listening. I hope you enjoyed as much as I enjoyed giving this presentation. Feel free to contact me on LinkedIn or through email. Thank you so much.